People who are poor and uninsured in America, irrespective of race, tend to get into the healthcare system late. When those people have cancer and get in too late, they will die. Poverty should not be an offense that is punishable by death. And yet, as things are often, people are punished by death because they're poor. This is a moral and ethical issue for this nation.
Prior to having the Latina nurse navigator, patients fell through the cracks. I didn't feel good about the program. I would go home feeling like, oh my God, what happened to this patient? She didn't come back. How are we going to convey that she needs to come back? Perhaps it's nothing, perhaps it's something that we need to follow up on. But I didn't feel good about our services.
Well, the greatest need is perhaps our need to educate this particular population. Many times they don't see the significance of pre-testing or pre-screening. Oftentimes they don't see the importance or the significance of follow-up. Some of the tests are just so routine. I mean, women go in for pap smears. We know that we're supposed to have them at certain times, in our lives. And so you go and it's sort of a standard procedure. But if something shows up on that pap smear, that patient needs to be notified. If that patient has no interest, or does not understand the importance of calling back, or as most of the time they're told to do within a 14-day period or 2 weeks, they don't do that. If we don't have addresses or phone numbers to reach them, then those people sort of go without ever knowing that they've had an abnormal screening. So when they come into the clinic, one of the huge things that we have to do is educate them about the importance of the tests and the follow-up.
A few years ago, it was a little bit different than it is today. We did not have access to hardly anything in Eastern Kentucky as far as cancer treatment. We do have that here now, and there are options that people can choose from. But to figure out where they are, to navigate that system, it's really hard. And a lot of people say, well, everything's on the internet. We deal with people that don't even have phones in their homes, much less internet. We deal with folks that cannot read or write, that need information. So navigating that healthcare system comes from lessons learned. It's not just getting them into the system. It's how do they get around in that system and what happens to them when they go home.
Because I recommend that home place rural health highly. If I talked all day, I couldn't say enough to tell about how much it helped me, because there wouldn't have been any way that I could have paid for my medicine, and I couldn't get the money anyplace else. I'm for programs like that because there's a lot of people like me, there wouldn't be any way to get medical help that they need. So I believe there should be programs to help everybody.